Assalamualaikum. I'm Dr. Sindhu, one of treating doctor here today. Let me confirm, am I talking with Mr. Ali? Nice to meet you, Mr. Ali. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. Is there anything else you want to add, Mr. Ali? Mm-hmm. I'm very sorry to hear about that, Mr. Ali, and I totally understand that how difficult situation would be for you. But to better understand your condition, I need to ask you a few questions. Is it okay with you? Thanks for your cooperation, Mr. Ali. So, can you tell me since how long have you experienced such palpitations? Mm-hmm. Okay. Do you experience difficulty in breathing along with that? Mm-hmm. Any chest pain? Dizziness? Mm-hmm. Okay. Ms. Ali, can you describe your symptoms in detail? Mm-hmm. Tell me more about that. Mm-hmm. All right, Mr. Ali. So when they start and how long do they last? Mm-hmm. And do you experience any triggers that make your symptoms worse? Like when you do exercise, when you are in stress, certain foods? Mm-hmm. All right, Mr. Ali, have you noticed any change in your heart rhythm? Mm-hmm. Okay. Do you have fever along with that? Have you noticed any bleeding from any part of body? How about your bowel habits, Mr. Ali? Mm-hmm. Okay. And what weather do you like the most? Mm-hmm. Have you noticed any change in your voice? Mm-hmm. All right, Mr. Ali. I need to ask a few personal questions to better understand your condition. Is that okay with you? Thanks for your cooperation, Mr. Ali. So, Mr. Ali, do you smoke? Mm-hmm. Do you consume caffeine or alcohol? Do you have high blood pressure? If you are taking any medication for that? Mm-hmm. Okay. And do you have high blood sugar? Any heart-related problem? Mm-hmm. Any neck-related problem? Any chest-related problem like asthma? Mm-hmm. All right, Mr. Ali, have you undergone any surgery so far? Mm-hmm. Okay. If there are any immediate family members suffering from heart problem, rhythm problem? Mm-hmm. Okay, Mr. Ali, have you noticed loss of sensation in your limbs? Uh, uh, reduced power? Mm-hmm. Okay. What do you do for living, Mr. Ali? Mm-hmm. Okay. And how's everything at workplace? Okay. If you are married, do you have children? How's everything at home? Mm-hmm. And how about your sleep pattern, Mr. Ali? And how about your mood? Mm-hmm. Are you physically active if you are doing any exercises? Mm-hmm. Okay. Okay, Mr. Ali, if you're taking any medication, prescribed by doctor or over the counter, okay. You have started any medication or stopped recently? Mm-hmm. Okay. Have you experienced any recent illness or infection? Mm-hmm. Have you traveled recently? Okay. Okay, Mr. Ali, if you notice loss of movement of lift for a few hours, blindness, which resolved after a few minutes or hours. Mm-hmm. Okay. Mm-hmm. If you are allergic to any medication, anything. Mm-hmm. All right, Ms. Shirley, in order to better understand your condition, I need to do physical examination. Is it okay with you, Ms. Shirley? Thanks for your cooperation, Mr. Ali. Could you please come on the couch? Then I will start from hands for nicotine stents, and I'll check tremors. Could you please stretch your hands, Mr. Ali, and separate your fingers? Then I'll check for cyanosis and clubbing, sweating. Then I'll check pulse if it is regular or irregular, and then I'll check blood pressure, and then I'll check anemia and jaundice, and simultaneously I'll be checking extraocular muscles movements as look up, look down, lift your tongue up, Mr. Ali, to check central cyanosis. Please swallow, and then I'll listen to the heart sounds in all areas, aortic, pulmonary, tricuspid, and mitral area. Murmurs or structural lesions. And then I'll auscultate lung fields, chest, lung bases, and apices. And then I'll check ankle edema. And I'll check carotid breath. Take deep breath, Mr. Ali. All right. Thanks for your cooperation, Mr. Ali. And then again, I'll sanitize my hands. And then I forget to check your weight and height, Mr. Ali. And could you please stand on this stand? And join your FV. Okay. All right, Mr. Ali, you can have your seat. So, Mr. Ali, if you have undergone any investigation so far, okay, ECG, and can I check it? Kindly show me. Okay, then I'll read ECG and pick FF. All right, Mr. Ali, the history you have shared and question I have asked and examination I have performed, and your ECG, after reading your ECG, I come to the conclusion that there is problem in the electrical activity of your heart, which we call in medical terminology is atrial fibrillation. Okay, and you know what is atrial fibrillation? Okay, Mr. Ali, you did not to be worried. I'm here to explain. Okay, actually, it does not cause any problem, but it may produce clots, which can cause, mini stroke or brain stroke, a heart attack. Okay, clotting in the arteries of the limbs. Okay. And heart rhythm can become very irregular and cause heart failure as well, if it makes sense to you, Mr. Ali. All right, Mr. Ali, may I know your exact age? Okay, 75. Okay. All right, Mr. Ali, so I will suggest you few lifestyle changes. Is that convenient for you to follow? All right, Mr. Ali, so I'll encourage you to eat healthy diet, okay, and more fruits and green vegetables, okay, and do regular exercise, okay, and I am going to prescribe a tablet, metoprolol. Okay, you have to take it 25 mg orally 2 times a day. Okay, it will control your heart rate and your blood pressure as well. Okay, and as you stated that you are 75 years old, so I am prescribing tablet Roxaban 10 mg. You have to take it once a day after a meal. Okay. And along with it, I am prescribing a tablet, atorvastatin, 40 mg. You have to take it um, at night time once a day. Okay. Is it convenient for you? Are you with me, Mr. Ali? All right, Mr. Ali. So there is safety netting. Okay. If you feel dizzy, okay, cold and sweaty with palpitations, okay, you experience any pain in any part of your body or limbs, okay, or you feel any weakness of any part of body, okay, you should immediately visit the emergency department of the nearest hospital. Are you following me, Mr. Ali? Is that okay with you? All right, Mr. Ali. So I'll suggest few labs like complete blood count and thyroid function test, okay, and lipid profile and echo, if not done already. How it sounds to you, Mr. Ali? Is it convenient for you? All right, Mr. Ali. So I am going to suggest you these labs. Okay, I'll write it on paper. Okay, and I am arranging a follow-up after 2 to 4 weeks to see the reports. Okay, and to check the response to drugs